students. Today we are going to see one of the important topic in the clinical ortho subject, which is going to be tennis elbow. Tennis elbow is not only a sport specific problem, but also if you look at the cases, most often the problem is encountered by non-sports people. So it becomes a very important domestic problem also, domestic clinical problem. Coming to tennis elbow, we are going to see the clinical aspect. So let us see the definition first of all. What is tennis elbow? Tennis elbow is nothing but a painful condition characterized by tenderness just in front of the lateral epicondyle of the elbow. So it's an inflammation of lateral epicondyle region. When I say lateral epicondyle region, it is nothing but the extensor origin of forearm. Okay, so there is a tenderness and inflammation and pain over the origin of the forearm extensors. That is what is called tennis elbow. Another name for tennis elbow is lateral epicondylitis. Okay. Coming to the causes. Is there any certain etiology is there? So looking at the etiology and pathological process that is undergoing tennis elbow, so far there is no clear pathology identified as far as tennis elbow concerned. But it is hypothetically believed that there might be some incomplete tears occurring at the extensor origin of the forearm muscles. So microscopic tearing are taking place over there. This could be attributed due to various repeated activities of wrist, especially the woman, the middle-aged woman or the adolescent-aged men or women, when they do the repeated activities with the wrist, as if they squeeze the cloth, playing with the racket sports, repeated activities. Okay, this happens. There is a strain takes place over the wrist extensor. Very particularly when it comes to sports, there is a mechanism is commonly attributed for the cause of tennis elbow. What is that mechanism? Any game that is played with the racket, like badminton or tennis, what happens? When they use the backhand stroke, like this, what happens? The ball is faced with a flexed wrist. And as they do the movement facing the ball, what happens? The wrist extensors are working. They are concentrically contracting. As they concentrically contract, the moment ball hits the racket, at a momentary of time, what happens? There is a sudden stretch of wrist extensor. Moment of time, and then the extensor tend to continue concentrically and the ball is hit. Okay, what happens at the time of ball hitting the racket is there is a moment of time the wrist extensors are undergoing eccentric contraction. That means they stretch at the same time along with the development of tension. This eccentric strain is believed that believed as if it is causing the more stress to the origin of wrist extensors at the origin point, especially the extensor carpi radialis brevis tendon, that origin part. Not tendon, it's origin part, the aponeurosis of the extensor carpi radialis brevis. So that is the most important causative mechanism identified from the sports field for tennis elbow. And coming to, we have seen the definition and the causes. There is no types and classification in the tennis elbow, whether it is a sports people or a domestic people. It is same as far as the mechanism, cause, pathology, and clinical features. Everything is going to be the same. So there is no particular classification in tennis elbow. Coming to mechanism of injury that we have seen now. In the common people, the repeated twisting action is a responsible one. In the sports people, is a use of backhand stroke while playing with a racket, tennis racket or badminton racket. Coming to clinical feature, the most common clinical feature is the pain over the lateral epicondyle region. It is not exactly over the lateral epicondyle region. It is just in front of the lateral epicondyle region. There it will be pain, and not only that, there will also be tenderness, perceivable tenderness will be there. Sometimes redness of the skin also can be identified. Along with this, some people might have stiffness of the wrist extensors and unable to move the elbow to the complete extension. So final degree of extension at the elbow might be affected. Inability to do the complete pronation, inability to do the complete wrist flexion, all these things can be seen in the chronic cases. When there is a development of shortening of the wrist extensor, all these things can happen. So it normally starts with the pain and tenderness and might progress to muscle stiffness and reduction of joint range of motion. In the chronic cases, we can also see the wrist extensor muscle strength getting reduced. Okay. Coming to complications, there is no further associated complications are not there. In fact, the elbow joint, when we look at from the radiograph, it will look absolutely normal. And the problem is nothing to do with the elbow joint. It is only the extensor origin part is affected. Coming to special test, how we can identify. The two important tests are clinically seeming to be more confirmative. Number one is Cosen test. Cosen test is a resistance test actually. Okay, how it is done? When the patient is resisted, the elbow joint is kept at the slight flexion position, mid flexed position, and the wrist joint is flexed, and a resistance is applied to the wrist extensor. As there is a resistance for the wrist extensor is applied, when the patient is attempting to do the wrist extension, if the pain is perceived at the lateral epicondyle region, the test is confirmed to be positive. Okay, there is a problem with the extensor origin. That is what is Cosen test. It's a resistance test. Okay, so the interpretation is made when the muscle is subjected for tension, any load, it affects the origin part, and if there is a problem with the origin of the muscle, it tends to produce the pain. Second test is Mills test, MILLS, Mills test. This is a stretch test, passive stretch test. Okay, here the patient is kept again in the mid position of the elbow flexion, and then the forearm is pronated, and then everything is done passively, and wrist is passively flexed. As all these things done, finally elbow is extended. As we do all these things, what happens? The elbow extensors are gradually stretched. At this point of time, if the patient perceives any pain over the lateral epicondyle region, the test is confirmed to be positive. Okay, what happens here? We gradually tend to stretch the forearm extensors. Because of this, if there is any problem with the lateral epicondyle region, epicondyle origin part of the forearm extensors, it tends to produce a pain. So that is how it is confirmed. And coming to clinical investigation, a radiograph, as I already told you, radiograph is absolutely normal. There is nothing to do with the elbow joint. And most often with the clinical features and the history and the special test, the tennis elbow is confirmed. So we don't depend much on the clinical investigation. If at all it is necessary, the soft tissue investigations like ultrasonic scans might be useful to test the severity or the extent of the problem. In chronic cases, it might be useful. Coming to clinical management. Clinical management can be conservative or surgical. Conservative, normally without any surgery. Conservatively, to reduce the pain, non-steroidal anti-inflammatory drugs are often prescribed to the patient. And some patients in severe cases, clinically, the patients are also advised to undergo hydrocortisone injection over the common extensor origin. That is exactly over the tenderness point. The injection should be given over the spot where the tenderness is identified. That is in front of a spot in front of the extensor origin. Only then the hydrocortisone injection procedure becomes successful. Normally, some patients might be benefited with one dose. Some people might require repeated dosage, 2 or 3 dosages. It is normally given with a 15 days gap. Okay, if the patient gets, usually after the injection, the patient will have a 24 hours of exacerbation of pain. After that, the pain will be slowly subsiding. So after that, the patient must be referred to physiotherapy for further management. If the patients, okay, the non-steroidal anti-inflammatory drugs and hydrocortisone injection along with the local pain relieving anesthetic agents, if it is not responding well, not helping the patient well, then the patient might be referred to surgical intervention. What is the surgery done? The surgery name is stripping of common extensor origin. What they will do is, the aponeurosis of the common extensor origin will be stripped out of the origin point, and then it will be allowed back onto the same place to get attached, to get healed. What happens because this procedure is, when they strip out the origin part of the common extensor origin, what happens? Some of the nerve fibers which are chronically producing pain, the pain sensitive fibers are also detached from the bone, so that the patient is not anymore not going to perceive the pain. So that is how it helps the patient to relieve the chronic pain problem. That is the surgical part, and once it is fallen back onto the same place, the origin part, the common extensor origin, gets attached with the bone. Okay, it heals. That is how the tennis elbow joint is managed. And I hope you all understood the class completely, and you can refer extra points also about this condition, because this is going to be one of the important conditions which we face in the clinical practice of physiotherapy. Okay, thank you very much. Have a nice day.